Welcome to my channel Brainies. In today's video we are going to discuss about the guidelines of neural tension test. What is nerve mobilization? Nerve mobilization or neural mobilization, it is a technique which is used to treat nerves that might be eddied, irritated or compressed. Most of the patients who've been unresponsive to other forms of physiotherapy and who has been present with a chronic history of directed symptoms like pain, numbness, or tingling in the arms or legs, they might respond to this neural mobilization. The neural tissue tension techniques are performed by the physiotherapist, placing progressively more additional tests, that is, tension, on the component of the nervous system that is being tested. It has been classified into two. One is the upper limb tension test and the other one is the lower limb tension test. It is used to evaluate the length and the mobility of the components of the nervous system. Basically, neural tension techniques are also used to release the tension, adhesions, or the stuck nerves, thereby restoring the optimal function. The neurodynamic testing includes the following. The first one is the straight leg raise test, shortly been abbreviated as SLR, median nerve traction test, radial nerve traction test, ulnar nerve traction test, and prone knee bend test. There is few guidelines for neural mobilization. Let us just deal it one after the other. The first one is the assessment and diagnosis. Before performing the neural mobilization techniques, it is very much crucial to conduct a thorough assessment to identify any neural tissue restrictions or dysfunctions. So, assess the patient's medical history, the symptoms, range of motion, and the neurological examination findings. Use of special tests such as neural tension tests can identify the areas of nerve dysfunction and compression. The next comes the patient's education. Educate the patient about the neural mobilization and its purpose. Explain the potential benefits including pain relief, improved nerve function and increased mobility. Also discuss any potential risk or discomfort which has been associated with the technique. The next is a warm-up. Before initiating the neural mobilization techniques, ensure that the patient is adequately warmed up. That is, incorporate certain warm-up exercises to increase the blood flow and prepare the tissues for the mobilization. The next is the positioning. Position the patient very comfortably on a treatment table or in a seated position depending upon the area being treated. Ensure that the proper support and alignment to prevent excessive strain on the surrounding tissues. Next comes the technique selection. Select the appropriate neural mobilization techniques based on the patient's specific needs and the areas of dysfunction. The techniques may include sliders, tensioners, or in some cases a combination of both sliders and tensioners depending upon the desired outcome and the patient tolerance level. The next comes the gentle progression. Start with the gentle mobilization techniques and gradually progress as tolerated by the patient. Monitor the patient's response throughout the session and adjust the intensity and duration of the techniques accordingly. The next comes the pain monitoring. Encourage the patient to communicate any type of pain or discomfort which has been experienced during the mobilization techniques. Also modify the technique or reduce the intensity if the pain persists or worsens during the session. The next comes the breathing and relaxation. Encourage a deep breathing and relaxation techniques to patient to enhance the effectiveness of neural mobilization. Emphasize the importance of staying relaxed and avoiding unnecessary tension during the treatment. The next one is the frequency and duration. Determine the appropriate frequency and duration of the neural mobilization based on the patient's response and the required treatment goals. Typically, the session may last between 10 to 30 minutes, with the treatment scheduled several times per week initially. The next guidelines is home exercise program. Provide the patient a list of home exercise program consisting of neural mobilization exercises and stretches to supplement the in-clinic treatment. The next is the instruct the patients on proper technique and frequency for performing the OM exercises. The next guideline is the reassessment. Periodically reassess the patient's progress and response to the neural mobilization. Modify the treatment plan as needed based on the changes in the symptoms, function, or the overall patient's prognosis status. The next one is the collaboration and communication. Try to collaborate with the other healthcare providers such as chiropractitioners, physicians as needed to optimize the patient care. Maintain an open communication with the patient to address any concerns or questions throughout the treatment process. So that's it with the guidelines of neural mobilization. Most probably in next video we'll just see about the neural tension test of upper limb and lower limb thoroughly. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.